This is the Royal Berkshire Simulation Centre, and this room is all about training. The idea is that we're training all our clinical staff, not just doctors, but nurses, midwives, paramedics and all allied health professionals. The idea is that you rehearse an emergency scenario before you meet it with a real patient, that you've had a chance to actually meet it and practice.
I had a go at resuscitating a patient who was suffering from an asthma attack, and they got me involved in listening to the chest, trying to listen for the breathing and hear where the lung had collapsed. And then they got me involved in actually resuscitating the patient with compressions, which are actually really quite difficult, and just teaching you the basic technique actually. It's very realistic, having an actual mannequin there who responds to the things that you're doing, and it seems to be a great training tool.
The setup that you see behind you is there's a real anaesthetic machine, a real crash trolley, there are piped gases coming out of the wall, exactly the same environment as you would get elsewhere in the hospital. We can replicate a ward or a theatre, or as in today we're set up to represent the emergency department. But this is the actual equipment, it's not pretend. It
was very realistic actually. It's not something that I would listen to regularly, but you can hear the wheezing of the chest and you can hear the heartbeats, all of which give a good indication, I imagine, as to what it's like on a real patient.
What we've got here is a fairly basic laparoscopic training setup. So it's designed to allow surgical trainees to practice basic keyhole surgical techniques. The benefit in particular with this sort of setup is it allows trainees to practice the basic keyhole techniques that are required for a lot of modern operations in a safe, controlled setting. And thereby enhancing patient safety.
This is what the NHS should be, really. This is all about quality and safety. It's all about investing in the workforce in healthcare. One of the greatest assets of the NHS is the people who work in it. It's not the buildings, it's not the politicians who put policy together, it's the people who work in it. It's the doctors, it's the nurses, the allied healthcare professionals, but also all the other staff who work within the NHS. And investing in that talent is what this unit is all about.
It's also about attitudes and communication skills and the team working and the resource management that you need in a crisis, and it's about human error. And it's really, the focus is really on about the human factors and how people interact in that crisis situation.